Hi, I'm Dr. Anitha Arockiasamy, President of India Home Healthcare. With regards to fall prevention, there are specific things that the family could do, to help the elders, be a little safer, when it comes to, preventing them from falling. The first thing is, making sure that the elders exercise regularly. When they do exercise, the muscles and the and the nerves, are worked out regularly, and the muscles are stronger, and the reaction time, from the nerves is good. So, so you're constantly conditioning them, and you're putting yourself at a much lower risk for fall. And the second thing is, checking your eyesight. Making sure that there is no visual impairment that's actually causing the fall. Again, going through your whole medication list and assessing, if there is any specific medication that causes excessive drowsiness or dizziness, which could again put you at a risk for fall. The fourth thing is checking the house. Making sure that all the areas where the elderly are moving is fitted with handrails, and that lighting is sufficient. Having non-slippery bath mats in the restrooms, so that they don't have they don't skid and fall in the restrooms. And also making sure that all the wires and everything are away from the floor and properly pinned to the walls. These could help us significantly with a fall, with preventing a fall. The consequences of falling, for the elderly, there's definitely, most of them end up with a black eye, which is a soft tissue injury around the eye. And this kind of gives us a hint that, that the elder might not have been conscious of the situation, when they were falling. The second, consequence would be definitely a fracture, it's most often the fracture of the neck of femur, which is the hip bone, and this puts them at a huge, inconvenience, because they are bound to the bed, for some days. Which is not, which if not addressed, properly, and if there is no proper rehab program in place, the patient tends to become bedridden, which could again, lead to a whole series of side effects, including, bed sores and muscle weakness, and disuse, atrophy of the muscles, and other things. Sometimes, even this, reason for, even becoming bedridden, could increase the chance for acquiring, something like a pneumonia, which could lead to death. So, there needs to be a proper rehab program, for the patient, and, the confidence levels need to be brought up. If there is a chance to use a mobility aid like a walker or a wheelchair, it needs to be encouraged. The elder needs to be, taught as to how to use the equipment and to move around by himself or herself. So after a fall, if you see that there is an elderly that's on the ground, you need to make sure that they are stabilized, and that there is no movement, excessive movement of the joints. Because there could be a fracture, which should not be handled by someone, who's not, trained to do that. So the best thing would be to keep them immobilized, and shift them to a hospital as early as possible. Call the emergency and shift them to the hospital.